This episode of Ask the Doctors is being brought to you by Wayne County Government.
What I understand in the Pfizer vaccine is the code for the spike protein, which on its own can't cause coronavirus for people who get the vaccine. And there's some lipids, and there's some sugar, and there's some salt. Those are the ingredients. There's no chance that you're going to get coronavirus, the illness, from the vaccine. And so I'm convinced that there's safety with what's in the vaccine and then how it actually works and what's inside your body.
Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. Our doctors are in their places, smiling, relaxed. It's been a good, restful week for them. Dr. David Jetmore, Wayne County Health Officer. Sir, good to have you back.
Well, welcome back, Dr. Jetmore.
Thank you, Tom. It's good to be back.
We heard you were tending to your pangolin flock last week. That's why you were absent.
Yeah, it takes forever to walk a ground sloth, too, so that took me a while.
We're off and running. And Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, troublemaker. How are you?
Great. Been trying to stay out of trouble this week, just so that I would be able to make it back on here today.
How's that working?
Well, I'm here.
Okay.
You know.
It has been I think, good week in terms of news for the vaccine. We've remained blue. A lot of Indiana seems to be blue. We've got visitors from various and sundry places in Indianapolis watching some basketball. The sun is shining. Our time is almost done, right?
Wish.
So much has changed from
maybe
just a few months
We're
ago.
wrapping this bad boy up. Talk about for you, Dr. Jetmore, what this week has been like, what you've learned new, how the vaccinations are going at the Elder Beerman building.
The vaccinations are going fantastic, as we've not wasted a single dose of vaccine. We've been able to vaccinate at least 120 people a day. The positivity rate continues to be low. We're at, I think, 2.6%. The state as well is around that number. I think 2.4 I saw yesterday. It may have changed. So infection rates are down, deaths are down, hospitalizations are down, and everything looks good. I think the only potential dark clouds on the horizon are these new variants of the virus that have a higher infectivity rate and some evidence that they have a higher, in some cases, resistance to vaccines and higher virulence rate. So we have a lot of that United Kingdom variant in the United States now, which supposedly doubles every 10 days. It's so much more contagious. So, but on the other hand, we're vaccinating 2 million Americans every day. Everybody we vaccinate is removed from that pool of people that can get infected and allow the virus to mutate. So I have a feeling things are good right now. We're gaining. I think the only other danger other than these variants is letting our guard down a little bit too early. You know, when a pandemic ends, it doesn't, this didn't begin abruptly. One day we had no infections and the next day we had thousands. It began gradually. And it's not going to end by, flipping a switch and saying the pandemic's over. It's going to ease down on the other side. And I'm hopeful that this trough will continue and we won't have another blip. But having said that, we'll see what comes to pass.
And he says that as he looks at you.
Well, I'm not great at prognosticating too far into the future, but when we get to the graphical portion of the program, we'll see what appears to be the case and where I think this could be going. And from my perspective, we've been spending a lot of time this week kind of analyzing a little bit into the numbers. We will see when we get to the graphs that we actually have a really good rate of vaccination in Wayne County and surrounding counties. We can be proud of that. But I think we can also identify that there are some gaps of opportunity, let's call them, in different ways, both in a geographic sense and in certain portions of our community that are not taking advantage of the opportunity to vaccinate at the rate that they really ought to be, from my perspective. So these are things that we have to develop some initiatives to try to overcome. And we're working on those now. But, from a scientific standpoint, there continue to be publications about the virus and vaccines and so forth. Some of the chatter around maybe we should change the schedule, the vaccination schedules, has kind of dialed down a little bit this week. Although toward the end of last week, there was an interesting publication that kind of looked at the effect that having actual coronavirus illness has on later vaccination, that people who previously had coronavirus disease get a much higher antibody response after their first vaccination of one of the two-shot regimens. And it raises the question of whether there's an opportunity that those people don't really need the full vaccination schedule, and that more vaccine can be reserved for people who are really virus naive, you might say, who've not been exposed to it. Mm-hmm. Maybe there's something to that, but that's going to take a lot more study to kind of suss out whether it makes sense to do. I get questions from time to time about this. In fact, just last night on a phone call, somebody said to me, not a medical person, but said, I had coronavirus disease. Do I really need to get 2 shots? And so, well, as it stands now, if you're going to get vaccinated with Pfizer or Moderna, you should get the 2-shot regimen. But I think it's possible that in the future there'll be alternate regimens that'll be studied, and we might be doing things differently from a vaccination standpoint in 6 months or more.
One of the things I heard this week, and you both weigh in, that the conversation of getting to herd immunity, whatever that number is, between 70 and 85%, we may be closer to, because those people who had COVID have antibodies, and if we count those folks in as being at least somewhat protected, maybe we're closer than we really believe. Is that a good train of thought?
Yeah, they say, and this goes along with what Tom was saying, that these people have antibodies. They certainly have some protection. We don't know, and it's not as predictable as it is when you give someone a vaccine that's driving the immune system. People may have had a small viral load or a large viral load, but at any rate, they have some protection. We've had over 30 million Americans have contacted COVID, so adding that to the vaccination numbers, they say I think 10% have had both, have been fully vaccinated. That would bring that number up to 20. That's a lot closer to whatever the herd immunity level is. I know it's not carved in bedrock, Eric. It changes periodically.
Well, I gave about 15% in there.
It changes according to the epidemiologist who's telling you what herd immunity is. I think that speaks to no one's quite sure of that number. It's a hard number to measure.
Sure.
So they're all educated guesses.
Exactly. I mean, herd immunity is one of these things, like it's kind of like computer projections. They're interesting and maybe have some good underlying concepts, but we don't know exactly what that number should be, and there are these guesses that people have. All we can say is that there need to be a lot of people who are resistant to the virus, immune to it in order to A, protect those who are more vulnerable by kind of reducing the possibility that they will come into contact with somebody who's carrying the virus, but also B, what Dr. Jetmore referred to is that, we don't like these variants, and so far the vaccines probably cover them, but, there will be more variants, and the way to kind of reduce the likelihood or the pace of new variant generation is reduce the pool of vulnerable hosts, because the virus has to mutate within a living host. So if we don't have vulnerable hosts, then the virus can't infect and therefore mutate. So the way to get ahead of the variant problem is to get as many people as possible vaccinated. And we've made a lot of progress in that area, but there's still a lot of work to do. I wish I knew what the number is. All I can tell you is what people say, 60, 70, 80%, but we don't really know what that number is. And all I know is I think we'll sort of have a feel for it when we get to the point where there are just minimal new cases, and it doesn't feel like at the point where you don't get much more return for vaccinating more people, you know what I'm saying, in terms of suppressing new cases. That's probably the point where we could say we're probably at a herd immunity level.
President last night said he's ordered up another 100 million doses, asking all the states to make every adult 18 plus eligible to be vaccinated as of May 1st. Talk a little bit about capacity for you all if that's the case. You've both said in the past that you could be vaccinating many more people than you are, except for the fact that you don't have it to give. I assume that's still the case. If they're saying by May 1st, okay, then everybody else should be available. You all should be seeing more customers, expecting more vaccinations. What are the numbers that you all think that you can do in your facilities, and how do you hit those populations that you were talking about a little bit earlier that may not be taking advantage of this opportunity? And the question becomes, is it not taking advantage of the opportunity, or is the opportunity not there because there really hasn't been enough vaccinations to hit people really where they live and where they need to be? Evening hours, weekend hours, for those people that are working during the day, that type of thing.
I thought about this a little bit, and to me there are probably three main factors in terms of how do you get vaccination levels higher. There are three factors. One is the supply. And when supply is limited, no matter what else you do, there's only so much you can give out. And for a lot of the health departments, particularly around here, I think this is true for the Wayne County Health Department. You have a big enough operation that if you could get more supply, there would probably be more uptake from your supply. Right now at Reed, we have a pretty good supply, and we have plenty of appointments on our schedule that are available. We feel pretty good about where we're situated. Then, after the supply issue, then it's a matter of access. Do we have enough points of access in places where people can get to them? And that's probably something that, needs more work. But that's why a lot of the many commercial pharmacies, the chain-type pharmacies, are getting in on providing vaccine. I'm not exactly sure who is around here now, but I know that Kroger, Meijer, CVS were supposed to, maybe Walgreens and Walmart. I'm not really sure what their plans were. They may be vaccinating now, but I don't know what their supplies are like. So, but at any rate, the proliferation of points of access in a conceptual sense is a good thing. That'll make it more convenient. But then you have the challenge of how to get out to the more rural areas and some folks who live in the more rural areas may have access issues of their own, transportation issues and such. So I think that's definitely an area that needs more work, is how to match up people to access points. And then the third issue is willingness, or willingness to take the vaccine. And there are still a lot of people who are very, at least, uncertain about whether they ever want to get it and haven't decided to pull the trigger on it. And you can see that in the statistics that you can get from the state website. It's you have to pull the information and kind of pool it and look at it in detail. But in Wayne County, as an example, you can definitely see that there's a relationship between age group and vaccination level, and so that the older age groups have a much higher vaccination rate than younger groups. And but you take the 80 plus age range, it's about 60% have completed, 60% of eligible 80 plus age group people have become fully vaccinated. About 70% have at least had one vaccine shot. And you could say, well, that's really good, but you know what? It's not. We've been trying to get after the 80 pluses for
those were the
a couple
first
months
available.
And basically, to me, I don't know what the upper end is. It'd be nice if we could get 100%, but the reality is some people can't and are never going to. So let's just pick a number. Let's say we think 90% is a reasonable point where you could get to fully with vaccination, but we're still 20 to 30 percentage points off of that. And that's in Wayne County, where we have a relatively high vaccination rate overall. So that's one way to kind of parse the information to say, where do we need to focus? And that's a great place to focus on the oldest age groups, because they are more at risk from complications and death from the coronavirus illness. So that's something that, I've been in talks with Christine and Dr. Jetborn and other health departments about what can we creatively do to try to get to more of the elderly folks who have not so far taken advantage of it. And in fact, we provided a little vaccine for the Wayne County Health Department's mobile unit to go out to, I think it was Interfaith Apartments today, and there's going to be a similar thing in Cambridge City at the senior apartment complex there. And they had, a significant number of people who hadn't yet taken advantage of the opportunity and are going to vaccinate with the mobile van. But, those are right kind of inaccessible places in the county. There are people kind of spread out, onesies and twosies here and all over the place. Mm-hmm. It's quite a challenge to get to them, so we have to do better at that. But then there are people who are just never going to do it, and that's unfortunate. So I think that goes back to how do we get people to take it up at the rates that we need to really protect them and work towards this overall herd immunity concept. So those three things: supply, access, and uptake are the key things, and it's a complex set of arrangements between those factors in my mind.
So you look at it from the public health standpoint, is it a not taking advantage of the opportunity? Is it a need to make the opportunity more available to folks?
Well, I think it's kind of a two-part question. One is, do we have the infrastructure to supply this? And I think we do. I think we have. We can give. Speaking for the health department, and probably I'm guessing I'm speaking for the hospital as well. We could probably give 5 to 10 times the amount of vaccine we're giving. Now, when you talk about people not showing up for an injection, I think there are many, many reasons, and they're often individualized. Some of them may be reasons that you wouldn't even have occurred to you. The other day somebody said, well, how much will the vaccine cost? And I thought it was intuitive that this had been paid for by the federal government and it would not cost them anything. So that for that particular individual, that was a stumbling block. I mean, they didn't want to pay for a shot. Some people do not like vaccines. Some people do not, their whole tactic is to avoid doctors and hospitals as much as they can. And
that's a guy thing, isn't it?
What?
That's a guy thing, isn't it?
Yeah, well, it is more a guy thing, which is probably why women outlive men. Right? At any rate, there are people that subscribe to all these absurd theories that the government's implanting something to track you in your arm, that it'll make you sterile, or all these other things about the vaccine that have been printed on the internet. So one or more of these may be active in many people, keeping them away from the doctor. And the other day I had an experience with a gal I know who said, well, I tried to get a vaccine and I can't do it. And I said, well, let me try. So I would be the last person you would ask to do any kind of computer stuff, Eric. So I threw myself into the breach. I said, let me try. So I go to rshot.in.gov and all the stuff pops up. So we put her name, I went through all this and got her an appointment. She was amazed. It was the first time anybody had shown amazement at my computer skills. But anyhow, I think that holds some people back. I think they may go to the site, they're not familiar with computers or with going through these things, and they're turned back, and they don't have anybody to help them, right. Or they don't want to ask anybody to help. So there's a myriad of things, and hopefully, look how far we've come, though. As time passes, we'll help each other. We'll help each other get on the computer. We'll dispel these rumors. We'll convince people that this vaccine is a good thing, and we'll get closer and closer. Some things have improved. As recently as last September, 44% of Americans said they would never get the vaccine. Now that number's fallen down to 30, which is really still an alarming number, but at least it's a number trending in the proper direction. So I'm hopeful for the future, but I think I see these as the myriad stumbling blocks that are keeping people away from getting vaccinated.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. And we are taking your questions on our Facebook page, or you can send us a question through Twitter at WCTV Info. We've probably been at this for, about 25 minutes or so. So let's see what we've got as far as questions for you gentlemen. Are we seeing less positive cases in longer-term care facilities because of the vaccinations administered recently?
I think we are seeing fewer cases. There have been some cases that popped up in one or two places inside the last month. Some of those individuals who became positive and mildly symptomatic had at least their first shot of vaccine or had first shots of vaccine. So you could make an argument they weren't really properly immunized yet. But it has been a while, and I think there are other ways you can kind of see that things are much, much better in long-term care facilities. We had set up a service to actually go out to long-term care facilities to go do monoclonal antibody infusions in their positive cases. And we did, probably 30 to 35 of those over the first month or so that we were doing them from about early January on. But in the last week, I don't think we've done any in a long-term care facility in about 10 days. And we haven't done any at all in our infusion centers, since last week. So, not only are the cases down locally in the community, but they're down in the long-term care facilities. So the other part of the question is that due to vaccination? And I'm sure it's part of it, but I think just the number of cases that you get in long-term care facilities kind of varies pretty closely with how much spread there is in the community, and the community spread is down. So that's a factor, but also vaccinations have got to help, because we know that they're very effective, even in those older folks. Maybe it could be that they're somewhat less effective. We don't know very much about that yet, but they are effective even in the older folks and people in long-term care facilities. So that has to be a factor. And the uptake amongst long-term care residents has been very high in all our facilities. It's been more of an issue with staff in those facilities, but even there's significant adoption by the staff, and so I think the combination of things kind of explains the numbers.
Well, the one difference between vaccination out in the community and vaccination in these long-term care facilities is we're vaccinating, we're getting close to that little intra-herd immunity in those nursing homes. And I think that is a factor of why the infections in the nursing homes have gone down. Certainly deaths have gone down. It's not a proven thing, but certainly it's very, very likely.
Okay. Next question. They welcomed you back. Dr. Jetmore, what is the nursing home visitation policy in Wayne County now since the new guidelines from the CDC? And how soon do you see it being even less restrictive?
Well, I think I knew that the new guidelines out from the CDC allow, in house visitation, it's much more liberalized than it was before. I think this is a good thing. One of the things the CDC has said that people that are immunized can be safely be in small groups, either with other immunized people or with a bubble of people who are unvaccinated. So having said that, I think that's what you're talking about in nursing home visitations. You're talking about vaccinated people, that is the resident of the nursing home, visiting either one or two members of their family who are or are not vaccinated. Now, having said that, I don't know if we formulated anything about distancing or mask or hugging or anything like that, but we certainly will do so soon, and it will be in compliance with what the CDC recommends. But I think we can liberalize that now, and we should. I think the people that have been in nursing homes, I think to a certain extent, have suffered from isolation, probably more than any of the rest of us. They haven't been able to get out and drive in their car or walk through a field or whatever that we can do to minimize the chance of infection and yet somehow get out of our room, get out of our house.
What is actually the guideline for being vaccinated? You get your first shot, 21 or 28 days later, depending on which one you get the second one. Second you get the second one, are you good?
No,
or you gotta
wait. You got to give your immune system a chance to generate these antibodies, and that usually is thought to be 2 weeks after your second vaccination.
Next question. Why would someone who had COVID continually test negative for antibodies?
Well, so it kind of depends on some things. We would expect somebody who actually had coronavirus illness, who had the right symptoms, who tested positive, definitely had coronavirus illness. That person should test positive for antibodies. But the question is, it depends on exactly which test you get and how it's interpreted. There are different methodologies that are used to determine antibodies, and some antibody tests only look for certain types of antibodies. Some look for multiple types of antibodies, and they have different thresholds for what constitutes positive versus negative. So you have to reach a certain level for it to be positive. And an example where I know that you can have a quote-unquote negative antibody test, but that doesn't mean you don't have antibodies, is with the blood center. They're looking for donors for convalescent plasma, and their standard now is that they need people with quote-unquote high titer. So the level of the antibodies has to exceed a certain high amount to be considered high titer, and therefore they're candidates for donating to convalescent plasma program. And so the test cutoff that they use is so high that if you don't reach that point, it'll say you're negative. See what I'm saying? So
Okay.
those are some factors.
You've
that
got
play a role.
antibodies, but the test is cutting off before it can be called a positive.
Right, because they're looking specifically for above a certain level because they want the donations. And so that's an example where you may test negative. And some of it may be timing. You know, if you had coronavirus disease a year ago, we think that the antibody levels after natural infection may actually drop off after a period of time, even as soon as 3 or 4 months afterwards. And the antibody levels may fall below the level of detectability, but that doesn't mean you're not immune, because there are other parts to the immune system that there are memory cells that retain knowledge of that exposure, that antigen of the virus, and should you get exposed again, it can cause the immune system to rapidly generate more antibodies again, or more rapidly generate an immune response to fight off the disease a second time. So there's that. And then there are some people that may have such a mild disease that they don't really generate significant immunity at all. And that's something that it's a part of what Dr. Jetmore referred to earlier, that we think that after natural disease, the antibody levels are quite a bit more variable. And it's thought that we think that people who have only mild symptoms, may generate less of an immune response, and they may be therefore less immune, and may be prime candidates for getting coronavirus more than once. So there are a variety of possibilities here into this question.
Anything you want to throw into that?
No, I think I'm going to stand aside.
You're going to let that one ride. All right. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Once again, we're having a chance to spend time with Dr. Thomas Huth, Dr. David Jetmore, taking your questions on our Facebook page as well as on Twitter at WCTV Info. Let's keep going. Next question. At the beginning of the pandemic, a shortage of PPE and disinfectant cleaners was prevalent. Are there any thoughts as to what types of items could be necessary to purchase now in healthcare if the new variants create as much problems?
That's a pretty smart question. I think the short answer is we don't know at this point, and we don't really have a reason to suspect that the standard precautions in terms of PPE and such like, and the disinfectants that are used, will be any less effective against the variants. I suppose that's always a possibility, but we're really talking about a different set of considerations compared to, the question of whether the vaccines will continue to be protective against new variants. They're really different subjects, because the cleansers and the disinfectants work in a very different way from how the immune system generates immunity. So, but that's an interesting question. I think it will be horrifying if any of these new variants turn out to be resistant to the disinfectants that we know work against coronavirus now. But that's a really good question I don't have a discrete answer to.
I wonder, Tom, these new variants are so much more infective. Mm-hmm. I wonder if we might need to redouble our efforts in terms of PPE mm-hmm. and masking, either N95s or something that I'm thinking of. Nurses taking care of patients in intensive care units with these new variants. We may have to double down on our efforts to keep respiratory spread at bay in treating patients with these new variants.
There's always kind of an after-action type of thing, and the question kind of went to it. At the very beginning of this, we found there was a shortage of everything from basic PPE to, you talked about certain types of needles to be able to do tests and things of that nature. How does the medical community, as we hopefully turn the corner on this, begin to talk to our legislators about what's necessary? This isn't the first pandemic, this isn't the second pandemic. Something else may come around, whether it's a year, 5 years, whatever the case may be. How do you talk about preparation for something like that, particularly from a public health standpoint? How do you get our leaders to understand that there are certain levels that need to be maintained, even though it may seem like we're wasting money. There's a certain preparation that's needed so we don't end up caught like we got caught at the beginning of this.
Well, this, we can look back in history and see what's happened in the past, and there's a particular pattern here. After a outbreak of any bad virus, SARS, MERS, then the politicians are keen to help public health departments in terms of funding. But as time passes and there is no infection, those budgets start to methodically get cut. And they had been cut repeatedly and yearly up until the onset of this pandemic. So I think we will be amazingly prepared for a pandemic in the few years following this pandemic.
Yeah, I think that's probably true. I hope that there'll be some soul searching about, okay, what's going to be a more effective, how do we break that cycle? What's going to be a more effective way to move forward? And to me, maybe some of it is improving the management and resupply of the national stockpiles of critical items. They turned out to be pretty woefully inadequate this time around. But to me, a bigger issue is, if there's a worldwide pandemic and virtually all your manufacturing of certain types of things like masks and ventilators is all done in China, there's nothing wrong with the Chinese, but that happens to be the case this time around. And they're the epicenter of the pandemic, and they don't have the ability to supply their own needs as well as ramp up to supply the world's needs. I think there are probably just some critical infrastructure type of items that can't be allowed to be offshored to the extent that some things were this time, and it was hard to kind of bring those back. So, certain industries have to be kind of hardened and prepared to be rapidly converted to producing critical supplies so that we don't go through these prolonged periods of not having enough masks, not having enough gloves, not having enough gowns and shields and that kind of thing. That was not a fun experience.
I think one of the things that Reed Hospital deserves to be congratulated for is we did not have a shortage of PPE at the hospital because Reed had stockpiled supplies that they had gotten earlier.
We did actually.
Which
we
was
happened to have
incredibly,
a lot.
I don't know who made that happen, but that was an incredibly great move and really helped us in the early stages of the pandemic.
Let's get one more question in, then we'll turn to Dr. Huth for some of his numbers, which will not be as bad as they had been. How long do antibodies last if you've had the actual COVID virus? Is it different for antibodies from the vaccine?
Yeah, we think it's different. We think the antibodies from vaccination are higher, longer lasting, more robust in a way. And I've already kind of answered the first part of the question. It seems pretty clear. I think there's more scientific work to be done to define this, but it seems pretty clear that after natural infection, it's quite variable about how high the antibody levels get, how long they last, how immunizing they are into the future, because for all kinds of reasons having to do with, the load that the individual, the dose, might say, a virus that the individual received, how robust their immune response was, how sick they got, a number, what are their underlying factors that can affect all those things. And, so many variables in there that you can see how there will be quite a lot of variability. But, with the vaccine, we have a standardized dose. We have a good understanding of just how much it sort of prompts the immune system to get into gear. And it's more reliably immunizing kind of across all the age groups and demographics. So vaccination is definitely the way to go. I don't hear it as much these days. You know, people used to argue, hey, don't get vaccinated, just get the virus, get over it, you'll be immunized. Problem is that there are other long-term consequences of the virus, of the actual viral illness, that we still don't fully understand, and it's best to avoid that, and get a better immune response to boot.
You know, as a general rule, a vaccination gives better immune protection than the natural disease. That goes kind of across the board of disease, and it tends to hold in this case when you're talking about the COVID-19 virus.
There's been a lot of things.
That is one of the tropes in the. I mean, there's a pejorative term applied to people who kind of have who don't like vaccinations, the anti-vaxxers, and that's just what they're called. I don't think it's good to call people names, but you know, but when you go look at their websites and things, as I have done, because I'm just interested, what are these people thinking? The case is often made, your kids will be better off if they just get these diseases, get over them, and they get more robust immunity and whatnot. But the problem is that that's not as true as you would think it should be, and that's why we had outbreaks of smallpox, outbreaks of polio, outbreaks of diphtheria, and everything else. Generation after generation after generation, they never stopped until we got good vaccines.
And the other
now
thing that
none of those things are really a problem.
The other thing that people forget, Tom, is these childhood diseases are not innocuous for everybody.
Right.
I mean, their children die from diphtheria.
Yeah.
They die from tetanus. They die from a myriad of these childhood diseases, and most of them don't. Most of them recover and have a certain amount of immunity. But I think when we have the ability to prevent disease and we say, no, let's go ahead and let our children develop immunity by having these diseases, I think that's entirely wrong-headed.
Yeah, that's what was done. You know, human beings have been on this earth for 600,000 years. That's what was done for 599,900 of those years, because we've only had good vaccines for these things within the last century is when they started. And the difference is just undeniable, but there are people who will attempt to deny it. And I think you can apply that analogy holds with COVID-19. Yeah, we could just let everybody get exposed to COVID-19, and yes, most everybody will recover uneventfully, we think, but we do know that there are people who are going to have long-term consequences if they do recover. And for sure, there'll be significant numbers of people, even if they're a small proportion, but significant numbers of people will have severe complications and die. And that's how we get to, hundreds of thousands of deaths so far, just in the U.S. And those people didn't have to die from this. So, to me, that thinking is completely the opposite of what it ought to be. And that's why we should be vaccinating.
And vaccination has the power to make diseases extinct. I mean, There is no more smallpox on Earth. So you do not have to get vaccinated for smallpox. And except for a small pockets in Pakistan, polio is almost extinct from the planet. So we can eliminate these diseases for the human race, which is pretty amazing that we have that power.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, speaking with Dr. David Jetmore, Wayne County Health Department, Dr. Thomas Huth, Reed Health. You have some numbers you want to pass along to us this week?
Sure. I brought in along a little bit of different things. And actually, if you, what we see here is a little different. We haven't seen this. I haven't brought this before, but this is actually from the state's website today. You can see the case counts across the state. And yes, they've been down. But I would argue that we actually have a change in the trend. It's no longer downward, it's sideways. And Dr. Jetmore has referred today and a number of other times to that we're in a trough, and I think that's exactly what appears to be forming as a trough. Whether it goes up from here or will just peter on and then eventually kind of peter out, hopefully that's what will happen. But the bottom line is, to me, it is way too early to declare victory and burn our masks. I know President Biden has been saying we want by July 4th everybody to, that we're going to celebrate independence from COVID-19 Day on July the 4th. I hope that comes about. But I think we just don't know at this point. But I just wanted to make that point. I'm not ready to declare victory. The next page is the Wayne County cases, and those have continued to go down. This week, actually, that's the national one. You can skip that, guys. Same story, really.
Next one.
It's forming a trough, not petering out quite yet. This is the Wayne County cases. And way down there on the right-hand side, I'm projecting that we'll have about 42 cases this week, which is certainly a vast improvement over a couple months ago. But again, it'll be about the same or a little bit higher than the number of cases we had last week, and is not inconsistent with the idea of being in a trough, meaning we could still have upswings later. The next page
About
is
how many weeks before you feel like you've got the trend and you understand what's happening?
Well, I think it just takes time, and we could say we're still on a trend or we're not. It's harder to see a change in the trend from the Wayne County and the Reed data. That's why I brought the state data, because I think a change in trend to me is clearer. It is no longer down; it is sideways. And so that's my only point. If that kind of gets to your question.
Yep.
We just have to see that the trend can be expected to remain until it changes. That's all I can really say.
Okay.
I do not know how long that will take. The Reed data, this is the whole epidemic-wide. You can see that Reed data continues to be in a downward direction. And then the last page is brand new. I haven't brought this before. We're starting to look at some internal data, kind of cutting it in different ways. I've referred to age demographics. There we can do a similar thing with race, which I did not bring today. Maybe I will in the future. But this is geographically. This is by all of by Indiana's kind of the gray bars, just for comparison. So the state has about 17% of people have had at least one dose of vaccine, at least a priming dose. 10% have had a fully immunizing dose. But focusing on the 17% number, and these are arrayed by the Indiana counties in this area, and you can see that all the ones, Wayne County is the highest at 21%, and all the counties contiguous are higher than the state average. But the outlier is Franklin County, a little bit more remote from Wayne County, but we consider that to be part of our service area, meaning Reed considers it so. And we're concerned about that gap. That's probably about, it is a smaller, more rural county, but that's a gap of about 1,700 people. We'll bring them up just to the state average that they're behind, and they're not vaccinating at a rate to catch up. They are actually going to fall further behind at the rate that they're vaccinating now. So we have had a conversation with the Department of Health, the State Department of Health. We've had a conversation with their local health department about what can be done to help them. State is trying to send task forces out to different parts of the state, and have asked us to maybe see what we can do to support Franklin County. So we're looking at some things to support them and get their numbers up a little bit. Maybe we'll do our own vaccination center there. There could be other possibilities. We're working on that now. But that's a problem area, and I think it's a problem for all of us, not just Franklin County, because we want, they're our friends and neighbors, and they come here to shop. We go there to vote, and that kind of thing. So we want to make sure that we're all in this together, and we need to help them when we can.
Why are their numbers down? Do we know? I mean, is it because they haven't gotten as much vaccine? Is it because
I think that's part of it. Their health department is very thinly. They just don't have the ability to support it with funding the way that they would like, and they only have so many people and access to facilities, and there's just so much that they can throughput that they're going to need a boost in that area, and we're going to see if we can go help them do that for a while.
You're watching Ask the Doctors. We're down to probably about 8 minutes left to go, so we're going to see if we can get 2 or 3 more questions in for our doctors before we call this a day. Can I choose what vaccine I get?
In most cases, no, because the clinic where you're going will only, in the case of the Wayne County Health Department, which is the Elder Bierman site, you know, like Henry Ford said, you could get any color car you wanted as long as it was black. You can get any vaccine you want at our clinic as long as it's a Moderna vaccine. Now, some clinics may offer more than one kind of vaccine. And I suppose in that instance you could choose. However, I want to take this opportunity to talk a little bit about these vaccines. These vaccines have the Moderna and Pfizer vaccine have efficacy rates that are around 95%. The Johnson & Johnson vaccine's rate is around 75 to 80%. Now, having said that, your protection of going to the hospital or dying from COVID with the Johnson & Johnson is 100%. In other words, if you get the vaccine, you're not going to get really sick, you're not going to go to the hospital, and most importantly, you're not going to die. So in point of fact, the vaccine you should choose is whatever vaccine you can get the first, because the sooner you get vaccinated, the sooner your protection will start. And the reason I say this is, and the reason I think this is important, is I don't want to see people fighting over vaccines. Believe it or not, the Germans were given over 1 million doses of AstraZeneca vaccine, and they decided, no, they didn't want that. They were going to wait for the Pfizer vaccine. So only 200,000 people out of a potential 1 million Germans who could have been vaccinated have been vaccinated. Now, those other 800,000 people are at risk for getting COVID. So all three of these vaccines are incredibly good vaccines. A vaccine that has an efficacy rate of 65 or 70%, that's an A-plus vaccine. That's a good vaccine. And you should get whatever vaccine you can get the soonest.
Yeah, and it's just not really, in today's world, it's not really feasible to have a situation where somebody can come in for a vaccine appointment and be offered a choice. Well, do you want Moderna today? Do you want Pfizer? Do you want Johnson & Johnson? Or maybe AstraZeneca will probably be next. Would you like that, one that's available? The problem with all of these is that they have kind of stringent storage and use requirements. So once we puncture a vial and draw up a syringe, we've got to use it in a certain number of hours. And so we can't just have the stuff sitting on a shelf. Oh, take this one today, not that one. You know, take your pick. That's why we actually at one time had both Pfizer and Moderna, and we've limited that to just Pfizer because it's much easier to manage when you have multi-dose vials, and we know exactly what we need to draw up. And in order not to waste any, we could just manage that better. You know, I would say you cannot expect for the foreseeable future to be able to go to a vaccination center and pick off the shelf which one you want. Now, if you were determined, I only want the Johnson & Johnson, then the thing to do is to, you know, find out where it is being administered regularly. And I know a lot of the commercial pharmacies, the chain pharmacies like the Kroger's and all that, I think they're typically using Johnson & Johnson. And so if that's what you want, then you're going to have to find somebody that provides that. So in that sense, you can have a choice. But you can't go into one place and pick off, you know, from multiple options.
There are clinics like that, though. I mean, they're not clinics here in Wayne County,
Not here.
But I saw where people were given a choice. And interestingly enough, almost everybody chose Johnson & Johnson because it's a one-shot vaccine. When they found out they did not have to make an appointment and come back, they chose Johnson & Johnson, and I think that's a reasonable decision on their part.
Yeah, I mean, maybe one day. I mean, one other issue with Johnson & Johnson, there just isn't the supply of that. I mean, the state of Indiana only got about 40,000 doses of it, and we were told this morning that they're now expecting. You know, we thought they might be getting some more next week, and apparently, no, that's not the case. They will not be getting more until sometime in April. So it's going to be hard to find if that's what you want.
We've got about 2.5 minutes left to go. We're going to see if we can get this one in. One more. Do I have to prove that I am eligible for the vaccine?
Well, when you register, you have to attest to certain things, that you're an Indiana resident, that you meet other eligibility guidelines, and and it's not just on age now. There are other reasons there are other factors in there, and it's all on there. Like teachers are going to be eligible come Monday. But when you get to a vaccine center, you do have to provide, proof of identification. There are certain things that you got to bring proof of, but you will not be generally not asked, at least not at the Kuhlman Center, to verify anything else. We assume that people are honest and are going to answer things in a forthright way on the attestations, on the registration. That's basically the way we handle it. We don't try to get into, we aim not to get into fights with people about whether are you really eligible or not. We just don't do that. Now, having said that, there are some people who are being invited specifically by the state to participate, and they're being notified of their eligibility. I'm thinking particularly people with certain comorbidities who are kind of nominated by their healthcare providers. And they get, when the state approves them, then they get a notification in an email, or I don't know if it comes in a letter, but certainly an email or a text saying, you are eligible, take this, here's your code, take this and show it to the vaccine center when you go, and and they do have to show those.
Okay. We are less than 60 seconds from being out the door. Congratulations, gentlemen. You've made it through another Friday. Thank you very much for being here. Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. As always, we appreciate the support. You have seen it. We probably haven't put it up as much this week as we have in the past, but if you are looking to schedule a COVID shot, you can do that. You can go to ourshot.in.gov. Put in the information. We are still holding at 50 and over. Long-term care residents are eligible to receive it, but the numbers, the names, the people keep changing every week. We continue to update you on our Facebook page and also on our social media. So join us again next week for another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. As always, I wish you well.
This episode of Ask the Doctors has been brought to you by Wayne County Government.
I think that vaccines, both the Moderna and Pfizer, are safe. Like all vaccines, it went through phase 3 clinical trials, which means it was tested both for safety and effectiveness on large populations of people. The Pfizer had 43,000 people in that clinical trial. Moderna had 30,000. We really need to encourage vaccinations, continue the mask wearing, keeping social distance, washing your hands, so we can flatten the curve appropriately.